Hello, Namaste. I welcome you all to this session 17 of Gurubodha. Today we have with us Dr. M.B. Gururaja sir. Dr. M.B. Gururaja is an Ayurveda professor and a famous Ayurveda practitioner from Shivamogga, Karnataka. His center is Dhavala Pentacare Ayurveda Treatment Center. And if anyone wants his personal guidance or on cases or to consult him for health issues, there is video consultation provision is available with him. Please go to easyayurveda.com/Guru Raja. So I welcome Dr. Guraja sir to this session.
Thank you, Dr. Janardhan.
And right away getting into the topic. First one on the agenda is regarding the presentation of Ayurveda medicine information in the websites and in lot of journals, in lot of Ayurveda magazines, many of the Ayurveda medicines in YouTube channels. We also run a YouTube channel in which we also share Ayurveda medicine information. So I had got a comment that should we really be doing that? Should the patient know all the ingredient list? And should the patient or the general public should be knowing how to use it, what is the actual dose? And will it not? So if we publish all the contents and ingredients, uses, dose, etc. of Ayurveda medicines, will it encourage self-medication? So of course, when we publish anything, we put a blank disclaimer that this is just for information or education's sake. But still, how good or how bad it is? Dr. Gurata sir, kindly share your valuable thoughts on this.
See, it's a basic right of a patient to know the contents and ingredients of any medicine. And I don't mind that he should not be, made aware of these things. Once a website or something authentic source or information giving a valuable information about the drug, the combination and dosage and everything, patient on the other hand has a faith increased on his or her doctor when she reads or he reads these websites or anything information or a source which matches with what his prescribing doctor has said. Definitely it will going to boost the morale of the patient. Point number one. Then point number two is there are a lot of information regarding the dosage and everything. It is a general dosage format. It doesn't fit to each and every individual. Each and every individual has to be prescribed the dosage and everything by a consulting physician. A consulting physician has to take care of that part, and that cannot be stress passed by the patient to go for a self-medication. Self-medication with any medication is always dangerous because you are not well aware of the facts about the medicines and their side effects, their combinations, dosage, and many other facts. So it should be very, very careful while going for this. It is just for the sake of information that whether my prescribing doctor has given me, for what reason he has prescribed these drug to me, these things to be known to a patient. And once the patient knows about these things, then his confidence in the medicine as well as in the doctor will increase. So for that purpose, and also to enhance the knowledge, because many times even the Western allopathic or other medicines also, there are a lot of information available on the net. So anybody can read. Similarly, for the Ayurveda also, if it is there, it is well and good. It should be a ready reference because not always you can go and consult a book. If it is available in a soft format, in a media, internet or something like that, it will be very handy for many a times, even for the even prescribing doctor for a brush up or even for a ready reference or some sort of remembrance what he has forgotten or maybe update himself for many, many reasons. This is always a positive thing. And from the point of patient, self-medication is always dangerous. You are not a prescribed or a qualified in that. You need to just to understand those medicines, and your doctor is the right person to fix the dosage for the medicines. So that is the one point. Number two, we need to understand. And moreover, I don't think so. It will promote for the self-medication. Nobody will dare to take an unknown drug without the prescription. It's not a OTC, over-the-counter product. It is a prescribed scheduled drugs. Nobody will going to take it like that. Everybody are nowadays health conscious. They will take a lot of precautions. They will consult the doctor and they will take it. And in any way it won't promote the self medication. And even our intention of publishing those things on the net is also not to promote for the self medication. Self medication is always a dangerous one, because we don't know the exact the combination and the exact dosage which is suitable to that person. So that's the reason we should be very careful in that part of it. So otherwise, publishing the details of each and every ingredients and how they behave and what the textual references given and what they are doing and latest researches connected to that, everything, if it is available on the net, there is no harm in it. That will just boost the information as well as the morale of the patient.
Today also the practice is there that many of the Ayurveda practitioners, they hide the actual list of ingredients. They'll just give a mixture of powders, and they'll ask the patient to take it without revealing what the ingredients are there in it, or what is the composition of the churna that is being prescribed to the patient. I mean, one thing might be that it could be proprietary, or it could be kind of a generational knowledge of these specific special Ayurveda medicines that Ayurveda practitioner is getting, that he wants to maintain the secrecy. This period is called as like information age. We need to be transparent, and patient has the right to know what the ingredients are there in the mixture or any medicine that is given. I strongly believe that it is the right of the patient to know the nature of medicine, sir.
Definitely, patient has the right to know what is being prescribed to him. He should be knowing about all these things, and even their side effects, a possible outcome of the therapy, everything should be known to the patient. And before, sometimes even some drastic drugs which are very sharp in nature, that they are being used as a upavisha dravyas in Ayurveda, similarly the chemotherapy drugs in modern. So such type of things, always they'll go for a consent. Patient will be explained the things, these are the drugs we are going to give, and this is going to be the effect, and this is going to be the side effects, probable side effects. Then you may have to go for all these things, and if you're ready for this, you sign the document, and then we start the treatment. So this is the better way of handling the things, and that is the way it is done. So the knowing information about the drug doesn't make anybody authorized person to prescribe or just take the medicine. So if we are qualified in that, then only we should go for it. Point number two is, those who practice mixing of their own combinations and hiding the actual drugs present in that and just giving the patient, probably what I feel is, this is where they try to keep the patients to themselves. So they don't want the patient to be moving, because typically the patients have a tendency that they will be consulting a doctor, taking a medicine for a time being, and suddenly somebody in the family, somebody in the close circle, somebody says that that particular doctor is very good in treating these type of conditions. I have sent that fellow and he has taken treatment from there. Suddenly he switches from this patient to this doctor to another doctor. Then it goes on. Then second thing, once a patient gets some benefit, then he tries to say that, doctor, I am in somewhere in US, I am somewhere in Bangalore, somewhere down there, I can't come to you. Can I take the medicines here? Then the patient may, if you are given a prescribed drug which can be available everywhere, then patient may take it from anywhere, and patient may not come back to him for that purpose. So in order to keep all these things as a part of their generation of economy and all those things, probably that is one of the important reason they try to keep the patient with them. For that purpose, they'll make these type of combinations. I have seen in some Kerala practices where 2 to 3 asavari stars are clubbed together and poured together and made into a bottle and given. And once the bottle is empty, then if you want a next dose, you have to consult once again doctor. So in order to keep the patient with them, they are doing all those things. I don't recommend these type of practices. If you are good enough and if your prescription has little real power, then the patient will definitely come back to you. You should have that giving a result, that should be there. So no, it's not a question of combinations. Second thing, when you are giving some powder or something like that without labeling it or without labeling the content in that, and it is in the open box format or something like that, or some without any seal, then you should be ready to face a bad name, where the people from the other field or something, they'll say that they have used steroids in that, combined steroids into that, and this type of the allegations will definitely do come. So in order to overcome that and make it a practice that whatever you give it in the form of a sealed one container, it is a factory sealed or something like that, it is always good. Otherwise, you label it whatever it is there in that, in the ingredients. That is always a better and a fair practice in any system of medicine.
Yeah, with steroid, I remember you had shared one of the very long back in 2002, 2003. You had shared, I don't know how I remember all these things. You had shared a patient's query that some patient had taken Swamala compound from you, and certain Swamala compound now it is rebranded as Swamala Chyawanprash, one of the very highly energy providing tonic, lack of strength, all those things very well. So you gave it to her, and she suddenly started feeling energetic. Within a week, so she started doubting on whether any steroid you have mixed or the company has mixed. So wherein your response was that let her come to me. I mean, let her send the. I mean, she was threatening that she's going to send the Chyawanprash bottle to laboratory for steroid test. And you were like relaxed because you did not mix anything. You just prescribed, or from the right from the shelf, and you were just relaxed, and you're telling that let her go to the this one lab, and if it is tested positive for steroid, then I am not responsible. I am totally relying on the company information. So it will be a headache between the manufacturer and her. So this kind of transparency and this kind of confidence is required. Like if we start doing our own things, like I mean herbal mixture on our own, especially when we are not revealing what it is there, and suddenly nowadays patients do a lot of testing on their own, and laboratories are quite open and available to everyone. If they go and test and if they find some certain chemicals, then we will be answerable. The practitioner will be answerable.
Definitely. See, nowadays, even people, if you give a powder, they can, if they find instantaneous relief, they will go and check for the steroid levels. Sometimes, even some powders of our Ayurveda may give rise to steroid positive results. But we need to understand that a synthetic steroid is different from a natural herbal steroid which is available in the plant, because if you are giving any drug containing kantakari or something like that, there may be a natural steroid present in the drug that may be there. So we need to understand that. Of course, the tests are also very specific nowadays. Very clearly, it gives out whether it is a synthetic steroid or a mixed one, or it is an no very natural one. Everything will be ruled out, and very clearly they give a results. So nothing to worry about these things. If anybody is having any, even many times I make a thing in the earlier in my practice times, as you mentioned, 2002 and that time. When a patient, if they say that about anything result which is instantaneous and they feel that there is something, then I say, you please go and check. If you find any steroid in the drug, whatever the amount you have spent on examination or investigation, I will pay for it, and I will stand along with you to sue that company on behalf of you. Then that is a confidence level, because whenever I select a drug, I select from a reputed companies where I believe that they have done a very standard and ethical way of manufacturing. So I don't mind. We should be very open to these type of things in practice. If you are quite confident on your practice and your what you call the strength of the prescription, then no need to worry about all these things. And of course, but if you give it to something which is not labeled and something mixturing of two to three things, and that is there, then always be ready to face the blame that you are mixing steroid or something like that.
Yeah, and Dr. Abhilesh Eklare writes, sir, if patient got relief from Ayurveda medicine and then he goes to pharmacy and starts treating by himself, that is not good for Ayurveda. So what's your opinion?
See, in India, we have got so many medical colleges, so many allopathic doctors, so many pharmacy colleges, so many pharmacists, But still, without any qualification, any degrees, there are quacks practicing very commonly across the villages and the rural areas of India. This is a very quite common practice. And Ayurveda was a household medicine from age old times in India. So there is a tendency that in the rural areas, people are knowing about our Ayurvedic system of medicines in their own way. But they may not be knowing the textual references and how their combinations or Chavanaprasha, how it cannot be. And of course, whatever if they do it also, they are always bounded by the legal consequences. And if something goes wrong, then they'll be at risk. And anything, if you don't say it also, if you don't prescribe it also, if somebody has given, it's a natural tendency in India, what we have observed is a patient comes to us, we are given a cough syrup or a combination for cough. He got relieved. What will do? On the next occasion, somebody in the family or somebody in the next house got the same cough, then he gives, you just take this combination which is given to me and it has given me result, you just take it. Then definitely these type of things you cannot avoid it. This is not possible to avoid. So this is very common. Don't worry about that. But anybody, if you are practicing near to a qualified doctor or a Vaidya and is causing a trouble in that, then you are always legally entitled to give a complaint against that person, one who doesn't hold any qualifying degrees. So to prescribe the drugs, then legal actions can be initiated by the local authorities.
Yeah, and we sometimes, Ayurveda doctors sometimes have to take into consideration that the patient is going to self-medicate, may go to self-medication with the prescribed medicines, and we have to have some kind of we have to give some kind of degree of freedom to the patient in our mind. Not saying that you go and take it by yourself, but we have to take that into consideration. And when we are prescribing something which is of a kind of a serious nature, maybe with maybe it contains basmas, or we are not intending a particular medicine to be given for a very long period of time, then we have to specifically say to the patient that this should not be continued, even if you do not. I mean, these are medicines which should be taken for A, B, C, D, E. These medicines are to be taken for 2 months, but this particular medicine should not be continued beyond 2 months. You have to stop it. So we have to take into consideration serious kind of medicines and limit and educate the patient regarding the seriousness of stopping it when it is required to stop.
So that is one point. The other thing is, if you don't want that your combination or a medicine what is prescribed for the patient number A should not be used to the other patient, then you straight away say while giving to the patient number A that this is a special combination which I am prescribing only for you for this condition, and don't give it to anybody else. That itself will make the things, it will be sealed. So it will be used by the fellow and it will not be prescribed to anybody. So if you are having any doubt that he may go for dispensing later on to other fellows and friends and nearby, you want to avoid that one, then you can go for it.
And Joe Marine writes, what is your opinion about the doctor having a student or an internee present during a private consultation? This is quite a common practice, especially in the Ayurveda centers associated with Ayurveda colleges, that those internees will be there. My personal opinion is that it's all fine, and we are all professionals, and the students are also kind of professionals. They will not be revealing their own patient's private information anywhere else. So it's kind of a standard practice almost everywhere. What is your opinion regarding this, sir?
One should not feel worried about the internees because they are the future doctors. If the future doctors are not properly trained and they are not well versed in their subject, and then how they are going to treat in the future? So whatever bodily or health condition evolved in you, maybe a good information for him to learn. So you should not feel that in a private consultation they will do. So nobody, no doubt, that is the ethics what we are being bounded in the beginning itself, that we will not disclose any information of these patients to any other fellow. Even to the family members also, many times we don't disclose the information. only and when and this is necessary to disclose, then only it will be disclosed. So one should not feel something like annoyed or something like that, that somebody is there, how can I know all these things. Be feel free, explain your problem to doctor in front of the internees, then they will also have certain ideas and they will also have some doubts, they will get your clarification, and even that will be a real way of learning for them. And one should encourage them, because see, it is something like that, somebody has donated the body to the Department of Anatomy, and that will be the basis for the dissection of the young students who are coming to the field of medicine to learn about how the body structure is. And if nobody starts giving the body to the Department of Anatomy, then how they'll learn? Then they have to learn it on a simulator models, which cannot be 100% exactly the what the body is. So, but you should not feel embarrassed or something annoyed about the presence of internees or something. If whatever it may be, usually in a private consultation also, if it is a young doctor or a young generation, it should be entertained. They'll be learning the things, and that will give them a clear idea of treating things. And who knows that someone may out of them may become a good, beautiful doctor in the future.
If it is like psychiatric counseling and a very deep personal matters, then they can always request the internee to stay out if the situation demands.
No, even in that situation, why you want to push out the internees? Because even internees should also get the information how to counsel in the deepest form things and the deep troubles in front of thing how it should be handled. They'll have first-hand information. It should be learned in that way only.
So the mantra is just consider the internee or the student as another doctor and trust. I mean, we never used to discuss all the, when we were internees and we were standing alongside the other doctors, seeing hundreds of patients. We never used to discuss all those patient things anywhere outside. It's kind of ingrained in a Ayurveda student practitioner to keep the secrets as secret, just learn the things.
Usually, the students' mentality is that if something is there, they will be concentrating on the disease part of it. They will not be concentrating about the who are you, what you are doing, and nothing. They don't have that information or interest in that. Their interest is that what is the disease, how to handle this. So that will be the idea of our students and those internees. So we should not feel bad, or we should not avoid those things. And internee should be there. If it is there, no problem. And if you don't want to that internee should be there in your consultation, then you should select such a private consultation where internees are not present. That is the only option left with anything. If you want a best doctor, and that doctor will always have a follower, junior doctors. So the junior doctors will be trained in on hand training. That will be of this nature only. So no question of that feeling bad or something like that. These are the young and future doctors. They should be given a proper opportunity to learn, and they educate themselves, and they get skilled in a particular manner, so that they can be future doctors. And maybe in future, some other time, that for my own problems, they will be the one who treat us. So we should entertain them. We should not be just avoid them.
And coming back to this medicine information or general Ayurveda information directly going to the public, as Ayurveda community members, Ayurveda is getting globalized. The Ministry of Ayush is, every day they're signing memorandum of understanding with one or the other countries. WHO is also involved now with, a lot of Ayurveda getting pushed all around the world. So when things are opening up, if we keep our medicines, ingredients, even our approach, all those things open out in the public, overall it serves the purpose of maintaining transparency, and it gives a good positive vibe or the good positive stance for Ayurveda. So we should be encouraging more and more knowledge coming out and people knowing more and more about us.
Definitely, we should keep the things open, and then only it will be good. And which gives very clearly, see, one of the bad name which is being tagged to Ayurveda is that they'll keep everything information as closed circuits. They'll keep this information closed circuit, and even the previous good old practice is that they never used to tell what is there in the medicine. Just because that they'll say, if we say what is there present in the medicine may not work. That was the thing which has been told earlier many times in folklore practices. So we need to avoid all these things. Let the things should be open and very clear. What are the content present in that? But let me add another point here. When a yoga or a combination which is been described or explained, which contains so many drugs in that, for an trained person and an Ayurvedic doctor or as a young doctor, he himself will find difficulty to remember all the ingredients present in a yoga. Then how can a layman suddenly just comes and read once and remember everything? Either it is in the Sanskrit format or it is in the botanical name format or something like that. It will not be easy for them to just do it. Only they can do is that for a similar condition, if I am taking this one, you try this one for that can be given to another fellow. That is the only thing what we have come across. Otherwise, if you don't want to do that one and mask that combination to be specific to this patient, then they say it is a customized product for you. You should not be handing over or you should not be trying on any other persons. It should not be given. It is peculiarly designed for your body nature and your body constitution. So if you say these things and give it, then they won't issue to anybody else. They'll only use for themselves. There's a way you can block it.
Yeah, and in the allopathic, I mean, modern medicine, Western medicines, they also give all the information like what to do if it's overdose, consult a doctor, or do the basic things and do this. And also one important thing that they cover, medicine information out in the public is the drug to drug interaction. So these medicines should not be taken with that particular medicine and all. If some website we also publish all those information in ayurmedinfo.com. So if the patient knows all those things, at least he will be aware of a doctor during his busy practice, in the matter of 15-20 minutes, he may not be able to explain everything. So it will be kind of a ready reckoner for both the doctors and patient that the medicine information is out there, and it will help both the doctor and patients together, like you said, sir.
Definitely, it not only help them because many times we might have conveyed many things to the patient, but may not be 100% conveying in a short duration. Then if something is there on the web or something on the internet, the patient, if you are very friendly with technique and this techno savvy, then he can read and study all these things by himself and make convincing that. Then if any doubts are there, he can come back to doctor saying that this is what I had developed a doubt after reading these things. Can you clarify? Then it is our duty to clarify those doubts. Only when you clarify those things, then only if they consume it accordingly and then the results are there, then definitely they will feel very good and they'll become the promoters of Ayurveda for future, and also they are the advertisers for you. So it should be it should not block those type of things. If they are posing question, let them pose. I am here to answer. If you have the tendency, then nothing will happen and it will be always in a positive direction. The things will move.
What is your reaction if the patient comes back and says, "Sir, you have prescribed this particular medicine and it contains say Vatsanaba, or it contains a marking net or Ballataka or certain basmas." How do you console? Or I mean, this is for educating a young Ayurveda practitioner how we should tackle that question.
See, very simple. If a person comes to us thinking that Vatsanaba, Nakshomika, Kupilu, all these things, they are the Vishadravyas, and these things, of course, they are Vishadravyas. We never said it is not Vishadravya. It is Vishadravya. But how can you prescribe it? Then my question comes, then how can they made it in the medicine? If it is a poison, then why they have put it in the medicine? There are drugs, if you just go through Western medicine, most of the drugs beyond the therapeutic dosage, they are poison. But still people are using it. So everything has its own limitation, and within that purview of the limitation, we should use it. Similarly, for Vatsanaba or Ballataka or even Kupilu or whatever it is, all these are being subjected to Ayurveda medication as a medicine. Before that, they will be subjected for Shodhana. They will be subjected for purification process. Once there is a purification, their toxic effects are nullified. Their therapeutic effects are enhanced. Then only we are using such type of dravyas. And moreover, these dravyas, if you are feeling is a poison, then why they have introduced into the medicine? If it is a poison, how can a doctor prescribe a medicine? I mean, a poison. It cannot be. So, it is a poisonous drug or a sharp drug or upavisha or visha, but it is being subjected for shodhana and purification, and that means toxic effects have been nullified or reduced to a great extent. Then only it is modified in the form of a medicine and it is prescribed in the medicinal dosage or therapeutic dosage. Then there is no question of any toxicity or toxic levels of problems. Of course, provided these, when the nanoparticles or the herbo-mineral drugs are there, if they are not properly prepared, genuinely prepared according to the textual references and the methods adopted, if you are bypassing it and causing it, something like in order to curtail and cut down on the production cost, if you are doing nonsense, then there is a chance of causing damage in the form of a toxicity. So we should be very careful in these type of things. So try to select the brands and the companies. They stick on to the very classical methods or the scientific methods of producing a medicine in a systematic manner and in a prescribed format and in a dosage. That will be very right way of selecting the one and using it.
And I remember one senior professor, Dr. Krishnamurthy sir, in his practice, he will openly say that yes, this contains heavy metal ingredients, they have been purified and processed. Yes, I'm intentionally giving it to you to a certain period of time because they have their own therapeutic effects. And he's kind of open and like free in his approach. So no hold back, and back the science and back yourself.
That's the reason. See, we need to be very clearly in our thoughts. Why you are prescribing a heavy metal? See, it is not a heavy metal. It was a heavy metal. When I am prescribing, it has become a light metal. Once it is becomes varitara, floats on the water, it is not a heavy metal. It is a light metal. So don't be in a dilemma that something heavy metal has been given. No, it is not heavy metal. Basically, previously it was a heavy metal, not now. Now it is in the form of a bhasma, and thus bhasma is floats on the water, varitara. It has attained such a level, and now it is in a nano size, and that nano size particle never gets sedimented anywhere in the body. It will be just thrown out of the body. It does all the therapeutic action and goes out of the body. Nowhere it is found. So that is the reason. That is the beauty of Rashastra, drugs. We need to understand that. Of course, when a particular dravya, medicine, containing metals or minerals that is being given like arsenic, mercury, lead, something like that. Of course, they are in original, they are formatted, they are toxic, highly toxic, heavy metals. But once they have been subjected for shodhana and all these things made it to a form of bhasma, and it has attained all the classical features of standard drug of what you call Rekha Purnata, Varitara, Apunarbhava, Nischandrika, and all these things. If it is very clear, then definitely we can use them in a right sense and right manner. Once it is used in a particular pattern, it won't give you any side effects. It won't. And of course, during the process of medication, if you check the serum mercury level or serum lead level or serum arsenic level, definitely it will be high. Definitely it will be high because we are giving them. But once the therapy has been stopped and the medicine has been withdrawn, after 15 days or 20 days or 1 month, then you check it up. Still, if it is high, then we need to go for some chelating agent to remove those toxic material present in the body. If it is not there, then automatically system will only flush them out of the system. So usually it won't be a big issue or it won't be a problem, provided if you select a right company, a right brand and a right medication in a right dosage.
Yeah, more open we are, and more good to the science as a whole, and more good for ourselves. That patient will start trusting and referring more and more patients. Another Ayurvedic, typical Ayurvedic mentality is that, oh, I mean, he has come to me again and again. The patient has to come to me only. He should not go outside. That's why I will hide the medicine name or give a specific therapy, which I will say that I learned it from my guru, so it's kind of my proprietary thing, and because it has spiritual energy, only I can do that. So these kind of practices hinder the progress of Ayurveda, and an open Ayurveda doctor with a scientific mind would not mind if his prescription is cross-checked or if the patient goes and takes the second opinion from another doctor, we should be open for that. We should be courageous enough to accept that.
Yes, definitely. See, whatever we write, it should be very clear, it should be readable, and it should be, understandable by the other person one who is reading. Very clearly, if a patient goes for a second opinion, then they should not tell that I can't understand what he has written and why this combination has been given for your condition. I don't know. He should not pass on such comments. So you should be very open and very clear about what reason you are given it. The second thing is, when you are prescribing a medicine, be clear for what reason you are prescribing it. So don't hide the things. Clearly say that this is because of this reason, for this purposes I am giving it. And I am anticipating this result from this. If it is that result is achieved, then that's well and good. For that purpose only I have given. So we need to be very open and very clear in our approach for what reason we are prescribing the medicines. And these particularly the metals and minerals, if it is there, nothing to worry. If these things while consuming, then definitely there will remain high in our doses, blood. But one need to understand that there is a difference between just a serum arsenic level or serum lead level or serum mercury level is high, is totally different from a toxicity produced out of lead, toxicity produced out of mercury, toxicity produced out of arsenic is entirely different. Toxicity has some lakshanas, symptoms, whereas it's only simply increased in body, serum. So if it is increased in the blood and it goes out after some days, there's nothing to worry about this.
Pradipaji asks, so what is Gururaja sir's approach to treat Prameha and Madhumeha in general, including how to understand Nidan and all?
See, very simple. If a patient comes to me, many a time it so happens, particularly in case of Prameha and Madhumeha and these type of disorders, patient approaches for a non-healing skin disease, the one which is not suppressing. He is not a diabetic. He doesn't know that he has a diabetes or something like Prameha or Madhumeha. His skin condition is not suppressing. So then out of doubt, when we go for, because when the skin condition is not going to yield or getting results, then out of curiosity, when we check it up, then we'll find many a times find that that person is suffering from Madhumeha or Prameha. This is one point. Second thing, there are some certain times patient complains with pains, vague bodily pains. Then also we suspect. And of course, when we take up the family history which is supporting, then we also suspect. These are the one areas we think of it. Second thing, for a first time, if a patient is getting diagnosed that there is a high blood sugar levels, then we need to elaborately check it out, because it's a laboratory tool which is supporting to our diagnosis. We need to understand whether it is already in the form of Madhumeha or it is only in the form of Prameha. See, very clearly, Ayurveda speaks about what is Madhumeha and what is Prameha. There are 20 varieties of Prameha which has been explained. Out of that, 10 are Kafaja Prameha. They are curable. So we can keep these 10 varieties under the category of pre-diabetic of modern. Second thing, there are 6 varieties of Pittaja. They are Yapya, and there are 4 Vataja. They are totally Asadhya, or they are permanent. So once this thing is understood, then we need to understand, we need to go for checking the sugars in urine. That is very, very important from the point of what Ayurveda speaks about. Ayurveda says that something which is required to the body is going through the urine is considered as Prameha or Madhumeha later on. Any Prameha, if it is untreated for a long time, then it is converted into Madhumeha at the last. So we need to understand these concepts very clearly. When a patient comes to us, we need to check it up all the grounds of Ayurveda part of it. Is a sedentary lifestyle, consumption of rich carbohydrates, sweets, or even dadi or dugdha, consumption of milk and milk products, many other things. Then is lifestyle, everything we need, we can make a note of it. Then after complete this protocol, then we can just check it up whether he has a sugar in urine. If sugar is present in urine, means this is not pre-diabetic, it is already in a diabetic stage. It is Madhumeha. So, repeated occasions, maybe in a gap of 3 days, 5 days, or 1 week gap, you can repeat the process of identification. Once you try to analyze the value of sugar in urine, on 3 successive occasions, if you don't find any sugar in the urine, then you can simply, there is a rise in the blood sugar levels, but there is no urine sugar, then it is very clearly it is a pre-diabetic stage. It can be reversed. The only thing is, once there is already a sugar out in the urine and it is in a large quantities, even protein is also there, triple plus, double plus, then it is very difficult. The patient has reached the age in a stage which is crossed beyond the pre-diabetic stage, and it is a clear-cut pre-diabetic or Madhumeha. So in that condition, accordingly, we need to select the drugs for the purposes. Of course, when there is type 1 diabetes where the person has become such a high level of blood sugar and even the urine sugar, and even with the medication it is not coming down, then he requires insulin. So that has to be, that is almost pushing the patient towards the very typical type of Madhumeha, which is very clearly Ayurveda says, which is asadhya. So we need to understand these concepts. Identify the sugar in urine. If it is there on repeated occasion, then it is Madhumeha. If it is not there in urine, it's only present in the blood, then it is a pre-diabetic stage. The things can be reversed. So this is the concept we need to keep in mind and practice accordingly.
Thank you, sir. And we will discuss diabetes, its Samrati and all in detail in coming up classes. Next topic is regarding the. I mean, we started this Gurubodha session with that regarding Guruji. Ministry of Ayush has come up with a clarification that Tinospora cordifolia is entirely different than Tinospora crispa. That Guru sir clearly made this point because both look very, very similar. I'm just sharing the slide with you. That they both look like very, very similar, but there are certain differences between the two. On the left side of the screen is terms for a cordifolia, which is the guduchi that we use and we love. But the crispa is the other one which may produce certain toxic effects or liver damage or whatever. So this differentiation should be very well noted. Guru Raja sir, can you please go through the differences between these two?
You please put those photos, pictures. That will be easier. See, you need to understand this. You observe the petiole being inserted into the leaf. In case of Tinospora cordifolia and in case of Tinospora crispa, there is a very clear-cut difference between the presentation. And if you observe there, the venation pattern is also slightly different. And observe the tip of the Tinospora cordifolia and observe the tip of the crispa. And moreover, the useful part, what we, of course, when you're in front of us, if the plant is there, then it is, we can identify it. But many times the useful part, what we get is that stem portion. You observe the stem. There are a lot of lenticles, projections in the crispa, which is absent in case of Tinospora cordifolia. That is a very clear indication that we should not use it when which is having some projections like thorny projections all over it, and we should select such a thing which doesn't contain such things. So that is a basic information we need to understand. Picture speaks better than the words. That's why I feel better if it is understood in that sense.
Yes, sir. I mean, the venations are kind of very gluey and ridgy, and the leaf looks thicker in the crispa than the cordifolia looks very softer than.
Yes, that's the reason.
That point, our narration of crispa or what we described was is again validated by the Ministry of Ayush. And moving on to the next topic. I mean, this is like 2 sessions before we were discussing come what may, we have to go with homemade foods, and women in the family should take charge, and of course men and other members of the family can can play a supporting role in that, in the process of turning our lifestyle into cooking the food together and eating the food together. There were a few comments just I want to touch base upon that. One comment was solution to women being busy and not getting sufficient time to cook is husband and other members of the family should join in. Next is what times are recommended. Next question was like what times in the day are recommended for food. 2 meals per day is the standard one as per Ayurveda. Whether it is lunch and dinner or breakfast and dinner, nowadays lunch and breakfast and lunch combined brunch, that style is there. So, what are your comments on that, sir? The meal times.
See, if you observe, not only in this, our younger generation are those people who are friendly and savvy. They are always pro for something new. See, when you are eating same old things, they are not happy with that. If the same thing been branded with some new name and a new twist to the things, same old theory, that is nothing but good old wine in a new bottle. They are happy with that. The brunch and all those things, this is the same concept just developed. Very clearly, Ayurveda speaks about one has to consume food twice. They never say it is lunch, breakfast, or anything. It is said annakala, a very clear term they have given. Two annakalas in a day. We need to take it twice. So very clearly, annakala. So whatever the way you want to call it, you call it as brunch, lunch, or breakfast, or meal time, whatever you want to call it, you call it. It is up to you. It's a true, very typical. Second thing I wanted to point out in this, of course, cooking is very clearly at a house a female dominated area. It doesn't mean that she has to only do it. A male can also do it. And in the Puranas and the references, whenever it is there, you just observe. It is always said Nalapaka and Bhimapaka. They never give any female name or any feminine names for that this one, because when Paka has to be done or some prepare, and even today, if there is some big feast or lunch, the people who do it is Batru, we call it as, they'll come as a male. There are group of people who are doing it, so they'll be cooking it. So it doesn't mean that only female has to do it. But in a family, in a small family, female partner or a female or the mother who is having a very pivotal role and very important role to maintain the health of the family members. And she holds the lot of money can be saved. If she doesn't do the things properly, then everything will go into waters. So she has to take care of the healthy areas, what should be prepared for and how it should be prepared and how it should be given to my family members. And she has a big role to play. If she does it in a right sense and a right manner, then everybody's family health will be protected. Otherwise, God only save this country. Everywhere there will be a lot of chaos and there will be a lot of problem. And that's the reason nowadays when a female is going out of the house for maybe because of economical constraints or maybe because of her priority of life or so many thoughts and so many things, they started eating from outside, straight away cooking somewhere else. Somebody is doing it and we straight away eating it, and we don't cook it at our home, or we cook at once and keep it in the fridge and repeatedly take it out and warm it and eat it and once again keep it inside and all these things, and using microwave oven and all these things. Definitely this is going to cause a lot of problem in future. So it has to be avoided. Ahara has to be prepared freshly. As and on day it should be done and it should be used. It should not be kept for next day. So these things have to be very clear in that. And of course, what should be combined, how to combine, what should be mixed, in what way it should be presented. Everything has to be systematically done. How our age-old mother, grandmothers used to do it. The same thing has to be keep in mind, because there's always a healthy way of doing things. And of course, any improvisation has to be done. That improvisation should carry the tag of, or they should not be avoiding the previous theories or just ditching the previous theories. those theories and those practical skills of how to cook it and how to do it, it has to be carried forward as a legacy, because it is the one which holds the key for the health.
And also, a minor point in what you're saying is not like women only should cook. That's kind of a misogynistic approach. But she should be responsible for taking charge. That's what we are trying to convey. We are not saying that women are fit to cook or anything in a wrong sense. Everybody in the family has certain responsibilities, and probably the kitchen responsibilities are best handled by women. That's how the structure of the family is built.
What I have observed is, usually something big, truck, 20 tire truck or something, wheel truck or something like that, big trucks usually, it is handled by men. But miniature things, fine things, which is always done better by women. So family is usually a small unit with few members, where she is the one who can handle it very properly, particularly the kitchen. And of course, when men are doing outside some work to earn their livelihood, then woman has to do it. If both men and women both are working in a family, then of course they both has to find out some time together to cook for themselves, because they are trying to earn money in order to keep up their progress and health and everything. And if they spoil their health, then they are to lose their money what they have earned to gain the health. So we need to be very cautious. We always try to understand in such a manner that we go to doctor and we get the health and get admitted in the hospital, and now we got a health. We are all happy that we know that from where we got health, but we doesn't know where we lost the health. That should be kept in mind. So what the things, wrong things we are doing it, which leading to the spoiling of health. Then after doing certain medication and regularly doing things and getting trying to overcome these bad effect and ill effect of the wrong deeds. So it is better do it in a right sense, in a right manner, and cooking in a proper way, proper combinations, eating them in a right time. It's always good.
And it's also kind of a matter of self discipline also, that we may do a wrong thing, eating in restaurant food. We may feel better now, but over a period of time these wrong mini habits kind of compound to become to big ill health sometime in the future in the form of cancer or diabetes and all. But when we really wake up that the laziness that we showed in our previous lifestyles, the lethargy that we showed, and the rules that we broke may come back and haunt without giving a chance to recover at all. So every day we need to be like disciplined, both mentally and also physically, to keep our health clean.
Definitely, that's the key tool, that we need to have physical activity as well as mental stubbornness should be maintained. And once we try to maintain these steps in the right direction as per the prescriptions of Ayurveda and the protocols laid down, it will be very good in order to keep up the health. Because health is a big issue, which may end up in lot of money being poured in, or even you can lose a lot of money in that area. So in order to avoid that, just follow the disciplines laid down in Ayurveda in order to keep your health in a proper position and a proper right directions. And it is better that follow the dinacharya, ritucharya, sadvrutta, and proper food. Avoid viruddha aharas. Consume food only when you are hungry. Right type of combinations in a mita quantity. All these things, it should be kept in mind.
And Pratibhaji writes, it also helps making a compromise of cooking at home. For instance, I work full time, but I like to make my meals fresh. I don't go for elaborate recipes. I pick easy recipes and also don't go overboard on chopping all the vegetables to perfect shape and all. That takes a lot of time away. A lot of modern practices force us to make fancy, elaborate meals and cook meals twice a week and keep on warming it every day and eating it. And this Instagram style of preparing dishes and making it perfectly looking for the picture, may not be for the stomach, it should be pleasing to the eyes, has made our expectations from food to an unreasonable high position.
See, very simple. Ahara is a rasapradhana dravya. It should be tasted through the tongue. But now we are giving importance that it should look good to the eyes. We are trying to perceive the senses of food from a wrong sensory organ. That should not happen. It should be tasted through the mouth or the tongue, and it is not just when this good looks good. All those looks good doesn't good do good to the body. So we should be very clear in that.
Vyomaji writes, is there a regular practice I can include in a day, every day, to reverse any effect of laptop screen on my eyes? Computer vision syndrome is kind of common. Castor oil or ghee made powder is good, recommended to be applied in the morning. Or would you explain the process of any eye strain relieving process? Sir?
Internally, consuming a cow ghee is always good for the eyes, so you can go for it. Still, if you have got a gut, better consult a doctor and go for a prescribed dosage of Mahatrifaladyagrata or Jivantyadyagrata in a prescribed format, regular consumption. That will also help you. Then Triphala Kvata eye wash after a workout. I mean, entire day if you are working it, at the end of the day, if you go for a Triphala Kvata wash for a few minutes, then it may reverse these effects.
Yeah, that tripla is like Vranahara and Amla being coolant and overall really helps to take the strain away. Next is Pradeepaji asks, also please suggest the ideal time to food should be consumed within after cooking. I have read in Bhagavad Gita that where Shri Krishna Paramatma explains Satvika, Rajasika, and Tamasika foods. And he explains that one which has passed one yama, that's 3 hours, that is considered as Tamasika. There's a shloka in Srimad Bhagavad Gita. Your opinion regarding this?
See, the maybe we'll keep it aside and we'll try to approach it in a scientific manner. Maybe that is a truth at those times, and the vessels and containers were something different, earthen parts and this, and they might have you lose their temperature by the time. That's the reason they are said, and there is a possibility of contamination, or maybe because of the growth or something like that. So maybe because of various reasons, they might have said all those things. But in present situation, when you are preparing the food in a very neat atmosphere and trying to keep it up in a quite good hygiene practices, and definitely in a containers which retains their heat and containing the things, of course, better you should eat those prepared food when they are still hot or warm. That is one thing what we can say. Of course, now we have got many containers and vessels which retain their heat for a longer duration. But thing is that once you prepare it, you eat it as per your agni. If you are feeling hungry, there is no time to wait for the things to be, you can go ahead and eat.
What can be prescribed in cases of anemia or vitamin D insufficiency when the client refuses to take any lohas or basmas, a typical problem in US maybe, and they are totally vegetarians? How to address the issue of anemia and vitamin D insufficiency?
Why a patient doesn't want to take the iron or loha basma or mandura? That is the most convenient one, which is giving results also. If you avoid it, then in what sense they want it? It
Yeah,
should be given. It should be given. You have to convince the patient that this is the one, because our body has iron in it. So why you are saying that not to take iron? Our body has iron. Iron is required. It is in the traces, and we are also giving in the traces. And what even the modern medicine also gives in the form of ferrous sulfate or ferric sulfate, the same thing. Ferrous oxide, same thing. That is also iron. So iron is required. You can go for it in the form of thing. And if patient doesn't want to take it, then we have to go for something like ayaskriti. Of course, that also contains traces of iron in it, and without that it is not possible. In case of any anemia or hemolytic jaundice or something like that, these are things usually Arogyavardhini or Ayaskriti or Punarnava Mandura or Navayasa Loha, these type of combinations are useful. And if you don't want to go for any mineral preparation or metal preparation, you want to go only purely herbal, then the option left out is only for you is Punarnava, Dadima, and Amalaki, and these type of things.
This refusal to take iron even by the patient doesn't make sense. Just because it has like basma, it's like loha basma, it's just iron. And even in the calcium, the modern calcium supplements, they are taken from coral and all. Many people, many manufacturers write that it is like coral calcium. They market it that way. It's purely an Ayurveda concept, isn't it, sir? Shankabhasma, Pravalabhasma that we have.
Definitely, these are from the natural sources. It is not factory made. So when these minerals and minerals, our body has a lot of such minerals. Different part of the body has a lot of minerals in our body. So that requires replacement is must. So we should not have a bad opinion regarding this by reading some other things which is not authentic or not genuine about the science. If you start going on commenting on that part, it is not a right way of doing it.
And the word basma has, unfortunately, has got a little taboo that, oh, it contains basma, I should avoid it. I mean, it's Shankabhasma is just calcium. It doesn't have any other ingredient other than calcium. Similarly, iron. So, I mean, we have a lot way to go. And I have talked to many Ayurveda practitioners from US, and I usually ask a question like, considering US population of 330 million, 33 crores, how many people have heard the name Ayurveda, or how many people know maybe say Chyawanprash or Amla? So what I usually get, the answer is 1 to 2% only have ever heard the name Ayurveda in US, and also I believe the same case being in Europe and Australia and all. So we, as Ayurveda practitioners, we are not only practicing, at the same time we are encouraging we are imparting the right knowledge to the patients, taking them into confidence, and not saying that it's just my own Ayurveda kind of thing. And that's a big business there. But it's my own Ayurveda. Like I learned it from my guru, and my guru selected me in particular and imparted this knowledge to me, and it's kind of unique to me. I mean, not going that way. Otherwise, we will have like Bikram yoga and other things which yoga went. We should not be going there. So keep open, keep transparent, keep learning, and keep imparting the knowledge. That should be the message, probably, sir. Your final comments on this.
That I have learned it from my guru, and my guru has given his powers to me, and I am treating with these things. To some extent, it is okay, but more or so, it is a promotional tactic, and it is just to keep the patient to themselves. For that purpose, it is been told in these things. Of course, certain times people, one who is really genuine and he has done lot of meditation and even some sort of skilled material, he has done it. In that situation, there may be some skillful technique he has learnt, and that may be a good, that if you want to have that, particularly for example in acupuncture or acupressure, it is a skill learned through a guru. Then if he is able to do it, and he cannot, I mean, similarly all persons cannot be a good surgeons. There are surgeons which they do a very less bleeding, and they'll finish up the things in a very fast manner. So that skill comes by practice, and if that is done, then it is skill. We need to give credit to that skills. But just for the sake of promotion, if you say that I only have this power and my guru has provided me, and this is, I don't agree with these promotions. That is not the right kind of promotion for any scientific fraternity or even scientific medicines. So Ayurveda is a very, very real scientific way of living, and it has promoted, and the acharyas, our earlier acharyas, they have given a lot of information without any taking any royalty or fees from us. They are given a huge knowledge library to us. And how can we become so mean that I cannot share my this knowledge to my next generation? It should not be. The knowledge should be kept open. Let them enjoy. And the more and more people come into the fold of Ayurveda, automatically the importance and the weightage and the information, everything grows.
Yeah, it is knowledge. I mean, Ayurveda is sometimes considered as Jnana Ganga, the river Ganga. I mean, more it flows, more pure it becomes, and more people get nourishment. So that should be there. I mean, that should be our mindset as Ayurveda stakeholders and promoters. So with that, thank you one and all for your active participation, and thank you, Guru Raja sir. So we are so happy. Thank you so much, sir.
Thank you. Thank you, all the participants. Thank you, Janardhan.